y'all, I'm Dr. Perez. Welcome to The Breakdown, where I break down serious mental health issues into everyday language. Today, I want to talk about PMS. Now, fellas, y'all need to listen too, but if you decide not to, please know this. Just because a woman is moody and doesn't feel like being bothered with you does not mean she is on her period. Maybe you're just annoying, acting immaturely, or just not on her priority list. Never, ever, ever, ever ask a woman if she's on her period if she disagrees with you. It's plumb rude and could potentially result in side-eye, sleeping on the couch, or a loss of teeth. Are we clear? I thought so. Have y'all ever heard of premenstrual dysphoric disorder? It's like PMS on steroids. There's a lot of overlap between PMS and PMDD. For example, symptoms usually begin about 7 to 10 days before your period starts and continue for the first few days. Both may also cause bloating, breast tenderness, fatigue, and changes in our eating or sleeping habits. Chances are that you've had some type of premenstrual syndrome since you started your period. Doctors think as many as 3/4 of us have some signs of PMS, whether it's food cravings, cramps, or moodiness. Y'all, we all know that PMS sucks, but PMDD is on a whole nother level. It is a severe and chronic medical condition that needs attention and treatment. Some symptoms of PMDD may include irritability or anger that may affect other people, feelings of sadness, despair, or even thoughts of suicide. There could be feelings of anxiety, tension, panic attacks, mood swings, even crying spells. There's a lack of interest in daily activities and relationships, and needless to say, decreased sex drive. You might feel tired, binge eat, or at times just feel out of control. Some physical symptoms of PMDD can include acne, back pain, muscle spasms, tummy problems like constipation, diarrhea, or nausea, heart palpitations, headaches, and dizziness, not to mention painful periods. These symptoms, especially the emotional ones, can take a big toll on your life, getting in the way of work, school, and relationships. They tend to go away on their own once your period starts, only to return after the next time you ovulate. Now, you may find that your symptoms evolve over time, sometimes for the better. PMDD tends to resolve on its own once you hit menopause. Symptoms of PMDD usually emerge during our late 20s. Less commonly, it may occur during adolescence. While any woman can develop PMDD, there are a few factors that increase our risk. Women with a family history of PMS, PMDD, depression, or postpartum are at risk. We don't know for sure what causes PMDD, but hormonal changes throughout your menstrual cycle may play a role. A brain chemical called serotonin may play a big part. It's the chemical that helps with basic things like sleeping, eating, and digesting. It can also play a role in feelings of well-being and happiness. It's considered a natural mood stabilizer. Serotonin levels change throughout your menstrual cycle, and some women may just be more sensitive to these changes than others. Luckily, there are treatments. Your doctor will talk to you about your health history and do a physical exam. Before she diagnoses you with PMDD, she will make certain that emotional problems such as depression are not what's causing your symptoms. Other medical or gynecological conditions like endometriosis, fibroids, menopause, and hormone problems also have to be ruled out. Aside from a complete medical history and physical pelvic exam, there are really no diagnostic test for this. Because there are mental health symptoms, your healthcare provider may want you to be evaluated by a mental health care professional. In addition, your healthcare provider may ask you to keep a journal or diary of your symptoms, and they may ask you to record over several months. Before your visit, write down the questions that you have that you want to be answered. At your visit, jot down any names of any medications, treatments, or tests that your doctor suggests. You also want to make sure you write down any instructions. Know what new medication or treatment is being prescribed and how it will help you. Also, what are the side effects? And are there any alternatives to traditional medicine? Treatment of PMDD is directed at preventing or minimizing symptoms. Those options can include antidepressants like SSRIs. That's your Prozac, your Zoloft. Those medications may reduce symptoms such as emotional symptoms, fatigue, the food cravings, and some sleep problems. Your doctor will help you determine if you should take the medication all month or only in the interval between ovulation and the start of your period. Taking birth control pills with no pill-free interval or with a shortened pill-free interval may reduce PMS and PMDD symptoms for some women. Some over-the-counter pain relievers like aspirin, ibuprofen, and your NSAIDs, those may help with some symptoms like headaches, breast tenderness, the backaches, and the cramping. Diuretics, also called water pills, can help with fluid retention and bloating. There are nutritional supplements. Consuming calcium daily may reduce symptoms of PMS and PMDD in some women. Vitamin B6 and magnesium may also help, but remember, talk to your doctor for advice before taking any of these. Remember, the FDA does not regulate supplements, so it's tough to tell exactly when you're getting or if it's even beneficial. Diet and lifestyle changes can help, such as regular exercise. It can reduce those PMS or PMDD symptoms. Cutting back on caffeine, avoiding alcohol, and stopping smoking may ease symptoms as well. Get enough sleep and use relaxation techniques like mindfulness, meditation, and yoga. Those things can also help. You want to avoid stressful and emotional triggers, such as arguments over financial issues or relationship problems whenever possible. As women today, we have about 450 periods during our lifetime. PMDD is long term. Providing these people with compassion and understanding is a first step in improving their outcomes. At the end of the video, I'll share free tools, resources, and information that can help you in this journey. I hope you all have enjoyed this episode. Please like, subscribe, and share. See y'all later.